I'd like to chat a little bit about rhinoplasty surgery because it is one of my great passions in life. I have to thank my rhinoplasty teacher, Dr. Alvin Glassgold, for teaching me a reproducible technique for essentially reconstructing just about every major nasal problem that I've seen in the office. So what are the goals of a successful nose job? Number one, to allow your nose to blend in and not call attention to itself. As I was mentioning earlier, the aesthetic is between the eyes and the lips, and if you have a nose that's crooked or too large in the middle, it's distracting. So, number one, rhinoplasty surgery is to make the nose look less apparent, less distracting, more harmonious with the rest of the face. While we're there, we improve the airway. If there's any deviated septum issues or turbinate issues, these are addressed at the time of surgery. And the other goal of surgery is to produce a completely natural, unoperated appearance. Conditions that I treat typically in the operating room are large profile humps that are too big to camouflage with silicone, bulbous wide tips, droopy tips, and long noses that need to be shortened. The non-surgical rhinoplasty is not appropriate for everyone. Rhinoplasty surgery, and especially revision rhinoplasty surgery, is deemed to be one of the most difficult facial plastic surgical procedures, so I always tell patients when I'm blogging about this on realself.com, choose your rhinoplasty surgeon wisely. This is one of my great passions, and I'm blessed to be quite good at the operation, and I'm blessed to have had a rhinoplasty teacher that has taught me well. Here's one of my nose job patients. She's 1 year after surgery. On front view, you could see that she's got a bulbous tip that was bugging her. I'm also going to point out her lips are one size bigger. We did a silicone treatment to her lips. In general, making the lips a little bit bigger tends to make the nose look a little bit smaller. On the 3/4 view, you can see that she had a profile bump that's been softened and her tip is elevated and a little bit more gentle. And on the profile view, you can just see that her nasal tip was overprojected. Overprojected means comes out too far from the face, distracting, too much of a bump. And after surgery, you can see she's got a natural looking unoperated appearance without a bump and a less projected nasal tip. I want to show the base view of the nose for two reasons. It changes. This boxy bulbosity of the tip is visible on the base view. This is called the lobule of the nose. The lobule is from here down to here. From here down to here is called the columella of the nose. I perform exclusively external rhinoplasty, which involves a transcolumella incision that's placed over here. So not only can you see a narrowing of the tip of the nose that's pleasing and attractive, but you can tell that the scar that I put over here is invisible in just about everybody. This is a patient who on front view has a tip, very thin skin. She's got asymmetrical cartilage in the tip, never had surgery before. The left side of her tip hangs down lower than the right side of her tip, and she's got some asymmetrical nasal bones at the top of her nose. These issues have been corrected on the front view. When you look at her 3/4 view, you can see that she's got an unattractive bump and a somewhat long appearance to her nose. And on the profile view, you could see that a nose that was just too big for her face, very distracting, has been brought down to size, so it's less distracting. She's happy, and what people see is a more attractive face. Oh, this is one of my happy college students, basketball player, multiple nasal traumas. Before surgery, somewhat of a crooked appearance to the nose, and again, a tip that hangs down too low. 1 year after surgery, you see a straighter, natural-looking appearance on the front view. On the 3/4 view, you get the idea that she's got a bump that's too big to camouflage with silicone. And on the profile view, now this is a tall girl that has strong chin projection. So there's a balance between the chin and the nose. So on somebody who's around my height with a strong chin, I don't want to curve out the bridge and make it over-resected. On her, I thought that a straight profile would be the most attractive given the fact she's around 5'10", and she has strong chin projection. Again, you see a natural-looking, pleasing, unoperated appearance. This is an interesting patient who I met with a congenital. She was born with an FLN, a funny-looking nose, where the tip of her nose sort of drifts over to the right side of her body. And you can see, I think these are around 4 to 6 months after surgery, you can see that the tip of the nose is now in the midline, and I have successfully convinced her to remove this piercing permanently from her nose. The rest of the piercings I couldn't touch. You can see that the profile bump has been removed. And again, on profile, this is a very petite gal. She's 5 feet tall. I don't want a straight profile. I want a delicate curve. It's effeminate. These are the goals that were established before surgery. And what's interesting about her is part of her congenital abnormality. This is the nasal septum. This is a severely deviated nasal septum that's deviated into the left side of her nose, that's causing the columella to curve towards her right side. And you can see after surgery, not only did I correct the deviated nasal septum and provide a more symmetrical appearance to the base view of her nose, but I also wanted to show the scar again. This scar is just imperceptible in everybody. I operated on this gal in the beginning of the summer. She's in my opinion an emergency nose job. 16-year-old high school student, varsity track team, beautiful face, a nose that's just too big. Her nose is too wide, her tip is too bulbous, her tip hangs down too low. This is early, it's 3 months after surgery. She's still a little bit swollen, but you can see a more attractive appearance. You're seeing her beautiful face, her beautiful eyes, and you don't see that distracting large nose. Again, you can see a nose that's more proportional to the size of her face, and on profile view on this patient, we decided to go for a gentle curve because I'm dealing with somebody petite, and this is the look that we were shooting for, and you can see that it's just a much more pleasing nasofacial harmony. Revision rhinoplasty, I just want to do a few slides on revision rhinoplasty because this stuff is difficult. This patient had rhinoplasty surgery by a local New Jersey plastic surgeon, and she consulted me about 4 to 5 months after her nose job because she complained to her rhinoplasty surgeon about the overall length of her nose, the fact that her nose was still too long, and as you'll see on the profile view, there's a very unusual operative appearance on the profile view, and the surgeon really dismissed her concerns and told her that, you know, it's very too soon after surgery, you have to wait, everything's going to be fine, everything is just swelling. So when I saw her at 6 months after surgery, I operated on her again because in my view, things weren't going to get better. I don't think that with time, a droopy hanging tip elevates on its own. And just to mention while we're here, I did a silicone treatment to her lips are one size bigger. When you look at the 3/4 view, you can see a tip that doesn't hang down as much anymore, and the real interesting view, which was so problematic for me, was her profile. This over-resection of the bridge over here, there was a bump left over here, too much taken off over here, and not enough taken off over here. And when I examined her, I just didn't see this getting better with time. And also I felt that her nose was too long for her face. So this is 6 months after my revision rhinoplasty surgery. This is another patient I operated on this year. I put his photos up, A, because he's extremely pleased with what I did, and also it demonstrates some chin augmentation. I put a chin implant in him also. He had surgery in Thailand with a nasal implant many years ago. The implant was removed. He was essentially concerned by the wide appearance of his tip, and you'll see on the following views that there is also a bump. There's a bump over here that needed to be dealt with. His other concern was he felt that he had a very pointy chin, and he wanted me to provide a more masculine, strong appearance to his chin. You could see a more pleasing appearance on the 3/4 view. And on the profile view, you can see this is the hump over here that I was referring to. It's been removed. There's a more pleasing nasal appearance. And you can see that the chin implant that I put in really balances the nose and lends to a more harmonious, attractive facial appearance. One more last slide on revision rhinoplasty. An appearance like this, and I'm only showing the profile because the front and 3/4 view doesn't show much, but this is a misplaced tip graft that was placed by another surgeon. And you know, something like this, an abnormal configuration of the nostril where there's a hanging columella, this does not occur in nature. This occurs from an encounter with a surgeon. I took him to surgery. I ended up removing the misplaced tip graft, and I utilized it to actually straighten this area and support his tip. And I also took down some of the bridge that I felt was too high over here for a nicer appearance to the bridge of his nose.